Well, hello everyone. It's such a pleasure as always. I'm Dr. Isabelle Amigues, your friendly rheumatologist. Today we have such a fun topic. And the topic comes from my recent question I had literally, I think back to back. Knowing that I'm a rheumatologist, I was asked, hey, my son keeps cracking their fingers. Is this something that potentially can cause arthritis? And I think we all have friends or family members that crack that finger. And usually the people who crack their fingers are like, man, this feels so good. And then the people who are listening to the cracking of the finger usually are like, stop doing this. And so it's usually not the people who are cracking their fingers that are asking that question. It's usually the people who are listening to the people cracking their fingers. And so then that's a really good question. So I was like, it's a question that comes again and again and again. The first thing is, what is that noise that you're hearing when someone is cracking their fingers? So you think maybe it's the joint that are subluxing. It's not. The noise that you're hearing is a bubble. So there are bubbles inside the synovial fluid, and as you're moving them, it can cause like the pop, pop. And that's usually what makes, this feeling of, sort of a release, and it makes feel good. What's really interesting is that there are some therapy, some sort of therapy treatment that use this cavitation system in, for example, for back pain. So I think chiropractor can do that specifically. And I remember in France learning how you can crack a back. Honestly, I hate that sound. I can't. To me, it's like you have joints, take care of them, don't hurt them, because it feels like you're hurting them. So the short answer is that it depends. It cannot necessarily cause arthritis. Um, but let's actually go a little bit deeper into the science of this. So, number one, the cracking of the finger is just this popping of a bubble, right? So it's not actually the joint. Number two is, why are they doing this when they're cracking their knuckles? What's the reason they're cracking their knuckle? Is it because they have pain? And if it is because they have pain, then it might not be that the popping is going to cause the arthritis, but it's actually a sign that maybe something is going on. Because remember, you are not supposed to have pain. You're not supposed to have pain. If you have pain in your joint, please come and see us, because it's not normal. There is no pain in joints, none. Not normal to have pain. Okay. So if you have pain and you need to do this, you need to crack your fingers, there is an issue and we need to take care of it, because while the popping may not cause the arthritis, there is a process that's causing the arthritis that we need to take care of, right? Like, why you have the pain is what we need to take care of. Okay, number one. Number two, if you do this too often, and this is literally like anything in our bodies. If you do this too often, it might actually cause issues, because imagine that you're keeping moving the joints. And it's not just that, it's also that, right? Like, so imagine that you're keeping moving the joints. At one point, it will cause issue, right? So yeah, if you're doing it here and there, not that often, but if you're constantly popping the joint, then it actually can cause some sort of issues of the plate of the cartilage, right? And that's the beginning of arthritis. So you do not want to do this on a regular basis. And then finally, if you feel that the popping is needed to actually move your feeling better, again, that's another sign that something is going on. So to basically go a little bit in the studies of those. Number one, it's actually pretty hard to look at studies of those. Why? So remember, why is it that not everyone is cracking their knuckles, right? So who are cracking their knuckles? How can you make sure that the people who are cracking their knuckles have absolutely normal joints? So you would, then need a study that's looking at patients, before they're cracking their knuckles, then during the moment they're cracking their knuckle, and then after 10 years or 5 years of cracking their knuckle, and then make sure that nothing happened in the meantime, right? Because if something happens, such as like in a rheumatoid arthritis, lupus, things like that, then you don't know that that's the reason that it's the knuckle cracking that has caused the arthritis. You don't know, right? So that's the first. That's the second thing. And then the third thing is that if you actually really look at this is a very big study to undertake, and unfortunately, there's no medication in the process, right? And so it would be really hard to have enough budget to do this study. So at the end of the day, you have to think, okay, one, do you have pain, right? So sorry, let me backtrack. You have to think of, we may not have the information that says for sure this does not cause arthritis or this cause arthritis. We just don't have the information, okay? So then the thing when you don't have the information is to think of it and have an educated guess. And the educated guess is, hi, Specimen Jones. Yeah, I'll come to your question in a bit. But yeah, so the question that you like, the thing that you have to think about when you have this nut crackling and you don't have the data to really say yes or no, it's causing arthritis, is to basically think, okay, what's the risk, right? Like, what's the risk potentially of having repeated motion in my joint? And is that normal, right? Like, is this something that I want to do my joint? I personally think that anything that's causing stress on your joint is not good. That you want to help the muscle, you want to help the tendon, but you don't want to put stress on the joint. This is why if you're a rock climber, for example, you want to make sure that you're helping your tendon and your joint, because remember, there's no muscle in your fingers. And so it's going to be the joint that are going to undertake the whole weight of your body, right? If you're only using your fingers and not your muscle. And so then, don't, like, repeating motion is not a great thing in joints. We know that, and we know that that can cause arthritis. So a repeated popping, if you do that several times a day, that actually may cause arthritis. And then the second thing is, why do you do this? Is there pain? Is there a reason? And what is there pain at all? And should we look into this, right? So yeah, I think it's an habit that personally I would not recommend, because again, repeated motion is not the greatest. Now, I don't think that we can say that popping your fingers are going to lead for sure to arthritis. I just don't think that that's the case. And so at the end of the day, I'm really sorry. I don't have the exact answer you would want and be like, yeah, for sure, or no, absolutely not. I think it's a case by case basis, and I think it potentially can do that. Okay. So in general, I personally don't like it. So stop doing it or do it somewhere else. But honestly, I don't mind it. And I'm just joking. And I just think that if you knew potentially that this can cause harm, why do it? Okay. Now, Spacey Van Jones, let's see your question. I have heard some conflicting things with regards to exercise for autoimmune arthritis. I've heard both good and bad. I really want to get back to lifting heavy weights and feel like I'm well enough. Is there anything I should be concerned about, or can I rest assured that it will benefit me? And you have psoriatic arthritis. So I really think it depends. Sorry, you're hearing this several times today. At the end of the day, if you are perfect, and we should be able to get you to perfect when you have psoriatic or inflammatory arthritis in general. If you are perfect, yes, go ahead and do all the things that you like to do, because that's important, right? Like, the whole goal of getting you to remission is so that you have a totally normal life. The only thing is if you have inflammation that's ongoing. And if you have inflammation that is ongoing, the issue is that by causing more inflammation, because exercise actually causes a little bit of inflammation, but it's what we call a good inflammation, right? And if you're doing that when you're in full flare, the problem is that it might not actually be really good for your joints. Heavy weight lifting, heavy weights is a little tricky to me because you're putting a ton of force on your joint. And so remember, an inflammatory arthritis, the endpoint of inflammatory arthritis, like if you don't take care of it, is actually osteoarthritis, right? That's why we call it secondary osteoarthritis. Well, if you have secondary osteoarthritis because of psoriatic arthritis, that actually is worsened by doing repetitive motion, once again, and heavy weight lifting. So it really depends on how you're doing that. If you're really good at heavy weight, if your position is really good, if you're working with professional, or maybe you are a professional and you know exactly what to do to prevent hurting your joint, then I think that's okay. And here is what I personally recommend to my patients, right? Is go slow and go progressively. You are used to probably do a lot of very weight, like very heavy weight. And what people forget is that if you have had an inflammatory arthritis and a flare, or something happened and you had to stop heavy weight lifted, then the issue is that you forget because you're finally good, and then you're going to go directly to those very heavy weights. I'm recommending to start lower. And in general, in rheumatology, this is what I recommend. Once you have achieved remission, and you say that you had 95% remission, so congrats, that's awesome. So if you had 95% remission, that's great. Maybe take a little bit of anti-inflammatory and then you reach the 99, right? Or like change your weight and things like that to reach like 5%, you can reach. You should be able to reach that with complementary measures. So that's important, right? And start slow and go progressively, right? It's kind of the same concept than when we decrease the prednisone. If you have been on prednisone for a very long time, which you shouldn't be if you're my patient, because I don't like prednisone, but when we decrease it very, 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 very slowly, because the progress is better than going down and then you're going up again because you need it, then going down, then up. And that's the same thing with the joint, right? Like with the heavy weight, is that if you go directly to super heavy weight, you might actually hurt yourself versus building the strength of your tendon, building the strength of your joint, building the strength of your muscle. So it is the muscle, the tendon, and the ligament that are taking care of your joint and not the joint by itself. Okay. Hopefully, this is answering your question. And it's not exactly knuckle pops, but it works, and it's still very important. And and so Binayak, hi, and the Galvez group, hi. And it's your 11-year-old that cracks his knuckle and says it's so satisfying. I would say, because I know you're 11-year-old. And hi, Maria. I know that your 11-year-old has a little bit of hyperlaxity. So hyperlaxity is when the joints are not completely stable. When you're young, it's actually normal to have hyperlaxity. When you're pregnant, it's also normal to have hyperlaxity, right? Because your body is trying to be very, very lax, so it leaves space into your body. And the problem with laxity of your joint is that it can cause, you can roll your ankle, you can sublux your shoulders, you can sublux your elbow. There are even people who sublux their hips, and the fingers. And so regarding the 11-year-old that has a little bit of hyperlaxity, and it's the fingers, I don't know it, but it looks like swan neck. So it can, like, they do like this, and they look like they have weird fingers, but they do it with their ligament. And my sister had that when she was younger. Well, if I think this hyperlaxity can explain why there is more bubble. And it is true that noise is satisfying for those who do it, not necessarily for the ones who are listening to it. But again, I don't know that it's necessarily an issue when you're young, unless they do it very, very, very often. Okay. But yeah, so, subluxity is to sublux. So not sublux, but sublux. So it's a luxation. It's when your joint, yeah, it's when your joints are getting out of the socket of where they're supposed to be. So, right, like when your shoulder, if you're like hurting your shoulder and you're hyperlax, the issue is that this can get out of your socket. Same thing for the ankle, right? Like you might actually just move your ankle and rotate because it's too flex. The tendons are too flex. So that's what and that's what I wanted to say. So anyway, we are coming. I'm trying to keep those under 10 minutes, and here I am at 15 minutes. But it's always such a pleasure. Send me your questions. I love teaching about rheumatology, and I'm gonna just put a plug in. We offer free consultation, and I'm gonna recommend that if you have any sort of rheumatologic disorder, if you do not know what's going on, if you are not sure this is rheumatologic or autoimmune, if you do not know if potentially we can help, please book a free consultation with our team. We will help figure out what is the path forward, and it will be an honor to take care of you. All right. Until then, I'm going to say hi and everyone. Hi, everyone. Have a wonderful week, and I will see you next week. Yeah, and the Galvez groups, yes, it is like dislocating, but less. It's not fully dislocated sublux. Thank you for keeping me in my toes because I'm so used to talking medical terms, right? So yeah, thank you so much, and I'll see you next week. Have a wonderful day, everyone, and every wonderful week too. Take care.